No matter what the setting for healthcare practice, the age of the clients who are the focus for healthcare services, or the health problems and issues that they may have, spiritual assessment is an activity that all healthcare professionals need to be able to engage in to more fully understand the client and to be able to provide holistic and appropriate care. Spiritual assessment also provides a much-needed avenue to communicate additional information to other professionals who are involved in the care of clients. Also, the healthcare literature indicates that there is a connection between spiritual well-being and health outcomes, and that spirituality can be an invaluable resource and strength for clients that can be overlooked if not attended to. Spiritual assessment is an imperative that is supported by the holistic nature of healthcare professions, by codes of ethics for healthcare professionals, and by a growing and prolific body of knowledge confirming the importance of spirituality to health. Just what is spiritual assessment? In its simplest terms, it is a means by which the healthcare professional can endeavor to understand the spirituality of clients. It helps the professional answer questions such as, what spirituality means to clients? What gives them meaning and purpose? What meaning do they make of the particular health issue or concern with which they are dealing? What is the quality of their relationships with others and with a higher power? What are their spiritual beliefs and practices, and so on? How spirituality is described by each client should determine the specifics of the assessment. For example, if a client describes his or her spirituality as being intricately connected to a particular religion, then the client's religious beliefs and practices should be included in the assessment. Through sensitive and appropriate assessment, a comprehensive picture of the client's spirituality emerges. Not only should the way clients describe spirituality be considered, but also how healthcare professionals themselves describe their own spirituality. This self-awareness is important, as the literature suggests that health professionals who have a clear, evident sense of their own spirituality are more capable to assess spirituality and also to provide better spiritual care. Awareness of one's own spirituality is also important in facilitating client-centered ethical assessment. There are many models and tools of spiritual assessment, each with its strengths and weaknesses. For example, Stoll's Guidelines for Spiritual Assessment, Fitjet's 7x7 model, the Jarrell's Spiritual Wellbeing Scale, the FICA method of spiritual assessment, and so on. This video program will focus primarily on Stoll's Guidelines for Spiritual Assessment. The intent is to provide you with some questions that are helpful for you to use. You will also see how a client's response to such questions can then guide the health professional to provide appropriate interventions. We will look at this assessment question and answer process through the voices of two people who are dealing with significant health problems, Doreen and Ed. Doreen suffered a spinal cord infarction which resulted in bilateral paralysis from the waist down. She underwent a lengthy rehabilitation and was left with a lingering disability. 4 years after the spinal cord infarction, Doreen was diagnosed with breast cancer and underwent surgery, chemotherapy, and radiation. Today, 5 years later, she remains cancer-free. Ed was injured in a motor vehicle accident. He and his wife were traveling on the highway when his car hit a patch of black ice. As a result of the accident, Ed was left quadriplegic. He continues a busy life as a writer and a community activist. Let's look at some questions that are commonly used in a spiritual assessment. It is not intended that these questions be used in a sequential spiritual history-taking manner. Rather, they are questions that the health professional can weave into conversations with clients. The logical place to begin is with the client's concept of spirituality and how that person's spirituality is nurtured and expressed.
Spirituality, to me, refers to God or a higher being and my relationship with that higher being versus religion. Some people equate the two together quite often, but to me, they're two very different items. Religion being a denominational, a set of practices that we have, where spirituality talks about my relationship with God.
I guess one spirituality is being aware of a higher power than yourself, a creating force that is creating things over and over again, from the cosmos, from the universe, on down to little old me and the baby in the womb. Being aware of that kind of power that's outside of me and that which I have very little control over, but may have a lot of control over me.
The religion part of spirituality is important to me in that it gives me a method and a means to connect with my spiritual faith and belief, either through church attendance, through a church family, and friends that will be at church.
Spirituality is important in the sense that I don't see myself as a lone entity in the universe. I'm not just me or other human beings. There's more to it, and it gives me a sense of being part of something bigger than me that I really don't understand, don't know anything about. But it's important to me because it gives me a sense of belonging to something bigger than I am. And I think we all need a sense of belonging to something bigger than ourselves. Nurturing and expressing are two different things to me, really. Nurturing my religion I do by going to church to worship every Sunday morning and trying not to fall asleep during the sermon, and singing in the choir, and belonging to a men's club, and talking to friends, and all that sort of thing. My religion is very much bound up with my daily life and the life of my friends and my family and so on. So expressing it is through everything I do.
I feel closer when I get into the bigness of nature, that I really feel how unique things are, and how I guess I feel like, how can this be created by anything but a higher being and a God. So I guess nature is one way that I feel that helps nurture my belief and my faith. And I also do a bit of art, and I also nurture it through my relationship with people. And this relationship that I have with God, the ways in which I guess I relate to God would be through prayer, meditation, and Bible study.
What gives my life meaning and purpose is waking up every day and thinking,